Dobutamine stress echocardiography, or DSE, is a specialized test used to assess heart function. By administering dobutamine, a synthetic catecholamine, doctors can simulate the effects of exercise on the heart, making this test particularly valuable for patients who are unable to exercise due to physical limitations. Whether due to arthritis, neurological conditions, or other factors, DSE provides an alternative method to evaluate heart health. During a DSE, dobutamine is administered to the patient, stimulating beta 1 adrenergic receptors in the heart. This leads to an increase in heart rate, stronger heart contractions, and higher oxygen demand, mimicking the effects of physical exercise. Echocardiographic images are captured at rest, during various stages of dobutamine infusion, and during recovery. These images allow cardiologists to see how the heart copes with the increased workload. Throughout the test, the patient is closely monitored using ECG, blood pressure measurements, and echocardiography. Dobutamine is given in gradually increasing doses, and if the target heart rate isn't achieved, atropine may be added. The test ends once the target heart rate is reached, significant symptoms develop, or if there are signs of ischemia or arrhythmias. DSE is a powerful tool in diagnosing coronary artery disease or CAD. The test detects ischemia, a condition where parts of the heart muscle don't receive enough blood flow. This is seen as new or worsening wall motion abnormalities during dobutamine infusion. DSE is especially useful for patients who cannot undergo traditional exercise stress tests. Another critical application is assessing myocardial viability, particularly after a heart attack. DSE can help determine if non-functioning areas of the heart could regain function with restored blood flow, guiding decisions for procedures like angioplasty or bypass surgery. Low-dose dobutamine can identify viable myocardium, indicating areas of the heart that may benefit from revascularization. In addition to CAD, DSE is used in evaluating valvular heart disease. By stressing the heart, doctors can better assess the severity of conditions like aortic stenosis or mitral regurgitation, which helps in surgical planning. Moreover, DSE plays a role in risk stratification and prognosis. It helps predict the likelihood of future cardiac events in patients with known CAD or those who have had a heart attack. It's also invaluable in preoperative risk assessment for patients with cardiovascular risk factors undergoing non-cardiac surgery. DSE is not only a diagnostic tool but also crucial in the ongoing management of heart disease. After revascularization procedures like angioplasty or bypass surgery, DSE can evaluate the success of the intervention and monitor for any recurrence of ischemia. It's also used in chronic CAD management to assess disease progression and the effectiveness of treatment. In cardiomyopathies, such as hypertrophic or dilated cardiomyopathy, DSE can assess the severity of these conditions and guide treatment plans. DSE offers several advantages. It's non-invasive, making it safer and less discomforting than procedures like coronary angiography. For patients unable to exercise, DSE provides an alternative way to evaluate heart function. The test also allows for dynamic assessment under stress, providing insights that resting echocardiography cannot. Additionally, DSE does not involve radiation, unlike nuclear stress tests, making it safer for repeated use. In summary, dobutamine stress echocardiography is an invaluable tool in cardiology. It enables the diagnosis and management of coronary artery disease, assessment of myocardial viability, and evaluation of valvular heart disease in patients who cannot undergo traditional exercise testing. Its ability to simulate exercise effects safely and effectively makes it an essential procedure for providing detailed insights into heart function.